Hello, welcome to my channel Medicine with Dr. Morin. I'm Dr. Keith Morin. Today I want to tell you what you can do to help your body beat Omicron before you get it. The advice in this video will also help strengthen your immune system. Omicron is now circulating widely in many countries, quickly taking over from Delta. It has a doubling time of only 3 days, which means cases double every 3 days. It will soon become the dominant variant around the world. Initial estimates suggest that the transmissibility of Omicron is about 3 times that of Delta, which was quite transmissible itself compared to the original variant. This, of course, is typical. Viruses mutate to become more transmissible. We have known for a long time that this virus is airborne, not just in respiratory droplets. It can stay in the air even up to 1 hour. Now that's why ventilation and frequent recirculation of the air through HEPA filters is so important. We still don't know of today, December 20th, 2021, how severe Omicron is. Initial cases, of course, have been mild, but these cases have been in much younger people and in people who have previously had COVID or been vaccinated. Many of the cases, of course, are also in travelers. These people tend to be more healthy. It won't be until we have data from people really at risk, in other words, the elderly, people over 50 with comorbidities, and people who are not immune, for example, that we will have a true sense of the severity of this variant. As I've been saying for many months, all of us are going to get this virus, and some of us are going to get it more than once. That's important because you want to have immunity before you get the virus so you don't get really sick. That's why it's important, particularly if you're elderly or you're older with comorbidities, that you get vaccinated. This virus is going to become endemic. We have significant animal reservoirs such as in deer, felines, mink, and it's even been reported in hippopotamuses. And we know this virus can jump from humans to these animals and back. Also, the symptoms that you get from this virus is very similar to other common cold viruses. Omicron, for example, is presenting with your typical common cold symptoms such as a runny nose, headache, fatigue, sore throat, and sneezing. Fever and loss of smell or taste is not as common with Omicron. So it makes it difficult for the average person to know whether they just simply have a run-of-the-mill upper respiratory viral infection or actually COVID. Testing is what's going to be needed to sort those two things out. Also, the spread will continue because this occurs before people start to feel unwell. So you may transmit before you're actually feeling sick. The goal, of course, is to protect those that are at risk of severe illness and turn this coronavirus into an illness that's very similar to the other 4 common cold coronaviruses. But what can you do to protect yourself so that when you do get the virus, this Omicron variant, your illness will be more likely to be asymptomatic or mild? On this slide, I've listed the major factors that affect your immune system. These include host factors, in other words, factors for yourself, such as your age, whether you've got any current illnesses, behavioral factors, and nutritional factors. There are chapters in this video for your convenience down below in the description as always. First, I want to talk about host factors. With respect to age, unfortunately, as we get older, the immune system does weaken, and we call this immunosenescence. There are a number of vaccines where there's a much lower immune response in elderly people. Often, for example, the flu shot, we actually give a larger dose in elderly people. So in general, the antibody response and cell-mediated response goes down with age and makes it more difficult for the elderly to fight off infection. This is obviously a non-modifiable risk factor. Now, age affects vaccine responses as well. For example, hepatitis B given in the first year of life gives lower long-term antibody responses than those obtained later in childhood. Of note with this vaccine is that even though antibody levels will wane significantly, memory B cells do not decrease over time. And this, of course, is what we're seeing with COVID infections. Your genes, of course, can predispose or cause autoimmune diseases or diseases that will affect your immune system specifically. Now we know that comorbidities such as diabetes, lung disease, gastrointestinal disease, liver disease, kidney disease, high blood pressure, and vascular disease such as heart attacks and strokes will also affect the immune system. Pregnancy is a risk factor as well, which we've seen with COVID. Pregnant females are much more likely to have a significant COVID illness compared to other people of the same age. The next factor is any current illnesses that you may have. Now, we all get sick from time to time, and the average adult has about 3 infections per year, typically of the common cold variety. This can be reduced, of course, with physical distancing and hand washing. This type of illness will ramp up your immune system, but if another illness comes along at the same time, the immune system can get a little overwhelmed. Frequently in hospital, we see people with viral infections in the upper respiratory tract that can subsequently cause a bacterial infection into the lung. Now I want to talk about behavioral factors. There are numerous ones which can be modified, which include smoking. If you are a smoker, smoking cessation lowers the risk of numerous medical illnesses, not just the usual ones we think about like heart attacks, lung disease, strokes, and cancer. Making a concerted effort to quit smoking is important. Alcohol use. Now ideally this should be no more than 10 units over the week in males and 7 in females per week. Now this means spread out over the entire week, not this amount over a 1 or 2 day weekend. So if you do consume alcohol on the weekends, no more than 1 or 2 drinks per day. Now what is a unit of alcohol? Well, 1 unit is considered to be a bottle of 5% beer with an amount of about 330 milliliters. 1 shot of spirits, which is 1 ounce or approximately 75 milliliters of 13% wine, would be another example. Stress, both acute as well as chronic psychological stress, can suppress the immune system. It can also lead to weight gain. I made a video on weight gain both in adults as well as children with respect to the COVID-19 pandemic. And this kind of weight gain is quite concerning for the future given the medical conditions which obesity is going to drive, such as high blood pressure. There was a recent study looking at high blood pressure in the population since COVID-19. People's blood pressure has gone up and people's health overall has definitely gone down with this pandemic. Next, this use of street drugs. This also can be harmful to the immune system and obviously has other consequences. My own personal experience as an attending in the intensive care unit saw more drug overdoses, particularly in the first number of months of the pandemic during the lockdowns. People have been more stressed over the past 1.5 years, and more people are unfortunately turning to drugs, both prescription and street drugs, as well as alcohol for relief. And that's not how we should be managing our stress. Sleep. How does sleep affect the immune system? Well, ensuring that you get sufficient sleep, ideally 7 or 8 hours of high quality sleep, enables a well-balanced immune defense that features strong innate as well as adaptive immunity. And it actually provides a good response to vaccines and less severe allergic reactions. That's something that's been seen in studies. Now, sleep disorders such as sleep apnea, where the airway gets closed off during sleep, insomnia, as well as other disruption to your normal sleep routine, interferes with the healthy functioning of your immune system. It's known that during sleep there's increased production of cytokines associated with inflammation, and it's felt that this response will help with the recovery from infection. Sleep also helps consolidate learning and memory in the brain. We don't exactly know how this process takes place, but it's believed that during sleep, energy is freed up for the immune system to perform those tasks. Sleep's also an important factor which determines how effective the vaccination is. When people do not sleep that night after receiving a hepatitis or H1N1 vaccine, the immune response to the vaccination is much weaker, which reduces the protection of the vaccine. Poor sleep also makes it more likely that they will be more susceptible to having an allergic attack. This is well described in the literature, particularly with respect to peanut allergy. There are many other health effects of sleep deprivation, but this is a topic, of course, for another day. Now, the importance of going to bed at the same time each night and waking up 7 or 8 hours later cannot be stressed enough. Exercise will help you maintain a normal body weight. In several vaccine studies, it's been shown to improve antibody response. This is helpful for general well-being and is in fact one of the best non-pharmacological treatments for depression and stress, which we're seeing a lot of in this pandemic. Now, ideally, 3 to 5 hours of moderate intensity exercise a week is what's generally recommended. People with activity trackers can aim for 10,000 steps per day. I do try to encourage my elderly patients in particular to ensure that they're doing some upper body and core exercises, not simply walking. You want to exercise your whole body. There are a variety of exercises that can be done to suit anyone. I encourage my patients to consider things like water exercises, strength training, dance, and even high-intensity interval training for people that can do it, to name a few. Next, I want to talk about nutritional factors and BMI. BMI is a ratio of weight to height, which is a rough guide to see whether somebody's underweight, normal weight, overweight, or obese. Many studies in adults show that an increase in BMI correlates with reduced antibody responses to a number of vaccinations, as well as less CD8 T cells and less production of the cytokine interferon gamma. Now, this likely plays a role in why obesity is a significant risk factor for COVID hospitalization and death. Nutritional status is also important. I like to tell my patients that food is medicine, and the quality of the nutrients in food do help turn on good genes and turn off bad genes. Macronutrients, particularly vitamin D, plays an important role in the innate, humoral, and cellular immune responses. It's something that we've seen throughout this COVID pandemic. It's important that people have a normal vitamin D level in the bloodstream, and there is a blood test to find out your vitamin D level. It's quite simple. It can be ordered by your physician. If you are insufficient, supplementation needs to occur with this vitamin. In the winter, or for that matter in other seasons where you do not have significant sun exposure, it's important to take vitamin D. It's our sunshine vitamin. I frequently get asked questions about the amount that's appropriate, and 2,000 units a day for most people seems about right. Levels, of course, can be checked in follow-up. There are some people that need more than this, but I think this should be driven by low levels on testing. I've seen several cases in my career of people taking 5,000 units a day chronically and developing significantly elevated calcium levels, as vitamin D will increase calcium absorption. There have been other studies looking at other macronutrients such as vitamin A and E, but these have not been correlated with benefit. Now, zinc may be helpful. In this particularly small study, there was a reduction in symptomatic COVID infections with supplemental zinc, 10 to 50 milligrams once a day. And of course, this needs to be confirmed in other randomized trials and replicated. Ensuring that you get the recommended amount of zinc in your diet can be quite helpful. Generally, that's somewhere between 10 and 20 milligrams. Notwithstanding that, it's important for people also to take a good multivitamin as part of their healthy diet. A healthy diet, as I explained to people, very basically means avoiding processed food, eating mostly plants, and not overeating. Try to eat whole foods where there's simply one ingredient, like broccoli, and nothing else. Look at the ingredient list if you're eating something that's put together, and if there's something there that you do not know or that's not in your pantry, don't buy it. It's important also to get the right amount of protein each day. An adult male weighing 175 pounds needs about 65 grams of protein every day, whereas an adult female weighing 140 pounds needs about 50 to 55 grams of protein, to give you an idea. It's also important to consume lots of healthy fats, which might include avocados, nuts, seeds, olives, olive oils, flaxseed, or even small amounts of dark chocolate. And if you're not vegetarian or vegan, fatty fish and eggs. The latter two are a good source of protein if you're having difficulty with trying to get enough protein in your diet. Fats and protein are essential nutrients and are filling, unlike carbohydrates are in general. I tell my patients to avoid fruit juice. It's always much better to eat the fruit than to drink it, as you get the added benefits of the fiber, which will ultimately slow down the sugar rise when you eat fruit. Lastly, being healthy is important to increase your health span and lifespan. Now, what do I mean by health span? Well, that's the number of years of life that you have where you're healthy and also have good quality of life. Following the advice in this video will help you in that quest, whether you want to beat COVID, cancer, or just extend your health span. Until next time, thank you for joining me today on Medicine with Dr. Morin. If you like the presentation, subscribe, click that bell for notifications, and stay tuned. Remember, get healthy and stay healthy.